Hi, this is Sarah with this month's Wellness Moments for August. We are going to be talking about preventative health. So, just an overview of what we're going to be talking about today. What is preventative health? What are the preventative health services available? And those include screenings and immunizations and oral health. Not something we typically think about with preventative health, but it is very important. So the purpose of preventative health is to avoid the onset of disease by engaging in preventative health measures like a healthy lifestyle, regular health services and screenings, just to make sure that nothing's popping out. Preventative health. One of the best ways to stay healthy is to prevent chronic conditions from ever happening. Some of these include eating healthfully, exercising regularly. If you're using tobacco, stop using tobacco, or if you haven't used tobacco, not using it. Getting enough sleep, and staying up to date on preventative health services and screenings and immunizations. A lot of times if you stay ahead of something or if you're checking in with your doctor regularly, you can make sure that you're not going to catch something, or if you do end up having a chronic disease, you can stay on top of it and manage it better with fewer adverse effects. Chronic health conditions that are preventable include heart disease, chronic lung disease, cancer, stroke, type 2 diabetes, and obesity. 7 out of every 10 deaths in the United States are attributed to chronic diseases, and more than half of all Americans have at least one preventable chronic disease. These are outstanding statistics, and a lot of us are impacted by chronic conditions. Preventative healthcare includes services such as screenings, checkups, patient counseling, immunizations, and these services can help prevent chronic diseases. And if you do end up having a chronic condition, you can identify it sooner with earlier intervention. Americans use preventative services half as much as recommended, mostly due to financial barriers. If you go to cdc.gov/prevention, there's an interactive prevention checklist that you can get specific recommendations based on your sex and your age. Preventative screenings are important because they can help you catch chronic health conditions early, as we've already talked about. This helps limit that impact of that condition on your physical, mental, and financial health. The United States spends over $3 trillion a year on healthcare services. About 90% of that is spent on people with chronic conditions. If you can shift this focus from treating chronic conditions to preventing them, this will help ease that economic cost on the healthcare system. Chronic health condition screenings include colorectal cancer screening, which is recommended for adults aged 50 to 75, breast cancer screening, which is recommended every other year for women aged 50 to 74, cervical cancer screening, which is recommended every 3 years for women aged 21 to 56, women between the ages of 30 to 65 who want to lengthen their time between screenings can also be screened with a combination of a pap smear and an HPV test every 5 years. Or lung cancer screening, which is recommended for adults aged 55 to 80 years old who have a 30 APAC year smoking history and currently smoke, or who have stopped smoking in the past 15 years. Osteoporosis screening is recommended for women aged 65 years and older, and it is also recommended for younger women who have a fracture risk equal to or greater than that of a 65-year-old white woman who has no additional risk factors. Screening frequency can vary based on other risk factors. During regular checkups with your provider, they also might check your blood pressure for hypertension, cholesterol for your hyperlipidemia, and your blood sugar for type 2 diabetes. Most health insurance plans will cover preventative screenings 100%. Before you make your appointment with your doctor, you should make sure your health insurance will cover the services in full. While you're at your doctor's appointment, ask how these services are going to be billed. Immunizations are recommended based on age, health conditions, jobs, and other factors such as travel. They include the flu, pneumonia, measles, polio, meningitis, and HPV. Adults should get the flu vaccine every year. Adults who have not had the Tdap vaccine should be provided the Tdap vaccine and a booster shot should be given every 10 years or sooner if you have a cut or a puncture. Women should get 1 dose of the Tdap during every pregnancy. Adults who are 50 years and older should get 2 doses of Shingrix, even if you have already had a dose of Zostavax for shingles. Adults aged 65 or older should get Prevnar 13 and Pneumovax 23 the following year for pneumonia. The MMR vaccine should be provided if you did not get the MMR vaccine when you were a child and if you were born in or after 1957. The HPV vaccine should be provided for women through the age of 26 and men through the age of 21, and you should complete the series. The chickenpox vaccine should be provided if you did not get the chickenpox vaccine as a child. The CDC has an interactive adult vaccine assessment tool to help you find out what vaccines you might need. Most immunizations are also covered at 100% by health insurance companies, but you should always check with your health insurance provider on exactly what is covered before heading to your doctor. Oral health is something not commonly thought of with preventative health, but it can have a large impact on our overall health and be an area that gets overlooked. We use our teeth to speak, eat, and smile. Our mouth contains bacteria though, and if they are not kept under control, they can cause inflammation and infection. Oral conditions can include cavities, gum disease, and oral cancer. Oral health has been linked to other chronic conditions such as diabetes and heart disease. People who have gum disease have a more difficult time controlling their blood sugars as well. Having a chronic condition increases the individual's risk of having missing teeth and poor oral health. Diabetes can reduce the body's resistance to infection, which can put those with diabetes at a greater risk for gum disease. To maintain oral health, you should drink fluoridated water and brush your teeth twice a day with fluoride toothpaste. Fluoridated water is commonly found in tap water. Brush your teeth thoroughly, floss, and use mouthwash to remove dental plaque. Do not use tobacco products as these can also harm your teeth. Avoid added sugars in drinks and food. Visit your dentist on a regular basis, even if nothing's wrong. Even if you do not have your natural teeth or you have dentures, go for checkups and cleanings, just like you would regularly with normal teeth. The best way to reduce your chance of developing a chronic health condition is to avoid key risk behaviors such as having an unhealthy diet, not exercising, using tobacco, or having poor sleep habits. If you would like to make some lifestyle changes so that you can have a better quality of life, visit your HealthStat clinician or you can talk to me and we would be happy to help you and provide you with resources that you need to succeed. Make an appointment today with your HealthStat clinician or your primary care physician to discuss what you can do to prevent chronic conditions. Here's the information for your HealthStat clinic, as well as our hours and our scheduling line. If you have any questions, please contact me at sarah.wiseman@healthstatinc.com, and I thank you so much for your time.